Hi there, Miss Durham here. I am going to demonstrate medication administration, and I apologize with all the snow. I haven't been able to get to campus to shoot this in the lab, so we are going to use things I have around the house and my 5-year-old videographer.
Oh, yeah.
Okay, thank you for my assistance there. She also helped with some of our props. But anyway, let's get to it here. I'm going to go ahead and start my medication administration, starting with my first check. I have my patient here. My patient is Jenny Roberts. Date of birth is 7/21/77. And I have her list here. So doing my first check and looking up what my meds are, see if anything is inappropriate. Jenny has no known drug allergies, so that's great. Jenny I got a report that she can swallow. She's on a regular diet, so I shouldn't have any problem with any oral meds. So let's look at my meds here. I have what's called omeprazole, and I have a 20 milligram daily, and that's for acid reflux. I have acetaminophen as needed for pain, and that's a 100 milligram as needed for pain. I have just checked on my patient, and she said her pain was 5 out of 10, so I'm going to give her that medication. I have a saline nasal spray, just for dryness, nasal dryness, and that is in her left nair. I have saline eye drops again for just for dry eyes. That's in her left eye. I have ofloxacin, that is for an ear infection in her left ear. And I have just 1 drop of each of those. 1 spray in the nasal spray, 1 drop in the eye, 1 drop in the ear. I have hydrocortisone cream for a rash on her left arm. And looks like I have a lidocaine patch for pain on her left elbow. Okay, so this is my first check. I have all my meds here, compared them to our MAR. I'm ready to go to my second check. So let's go over to our Pyxis. So if my videographer will sort of zoom in here that we have our Pyxis. Obviously this is one of our props that we're using, but in the hospital, it's going to be in the med room behind a locked door, and you get to your Pyxis station here and it is locked. So here we have our keypad. It's a 2-step. So we have our keypad where we punch in our code, boop, 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 boop. And then I'd have to do my fingerprint in order for the Pyxis to open. So now that it's verified me, let's say our Pyxis gives us access. So here we have access to our Pyxis screen, and I'm gonna put in the room number or the patient name that I need. I'm gonna say I'm getting Jenny Roberts. She's in room 314. In this instance, just for the sake of time, I'm going to go straight to my patient-specific bin and not look at every individual drawer because I don't have that compatibility here at my house. So our cabinet door opens, and right here is room 314. Right here, room 314, pharmacy has brought all my medications in 1 baggie for my patient. So I'm gonna close my Pyxis up here, and I'm gonna log out. And now it's ready for the next nurse to come administer medications. Okay, so I'm gonna do my second check while I'm here at the Pyxis. So again, I would have punched in every individual medication that I need, but I'm doing my second check here. I have my omeprazole, 20 milligrams in here. I have my acetaminophen, 100 milligrams. I have a nasal spray. I have an eye drop, or a nasal spray, an eye drop, and an ear drop. The hydrocortisone cream is in here, and then I have a lidocaine patch right there. Perfect. So I have everything that I need right here. So let's take all of this to our bedside. Well, let's go back to our bedside over here. Okay, back here we go. Okay, well, let's just spin back to the room. So here I am. Let's knock on our door. Hello, hi, Miss Roberts. I'm Miss Durham. I'm going to be your student nurse today. How are you feeling? Is your pain still 5 out of 10? Okay, perfect. I brought your Tylenol for that, so your acetaminophen. So I have all your meds here for you this morning, and I will scan them all and tell you what they are as we go, and you can let me know what you think. So I get all my meds down here ready, and try to do this in a little organized fashion here. Okay, so I have all of my meds here. Let me scan my patient's armband first and foremost. So I have my 3rd check here, and I'm gonna need to do my 2 patient identifiers. So I'm gonna scan my patient's armband here. I have Jenny Roberts, 7/21/77. When I scan her armband, she tells me her name and date of birth. Her information, her MAR is going to pop up on my computer screen for me. So I've got my scanner here to scan all my meds. Jenny, first I'm going to start with your oral meds. I have here for you first, let me scan this, and it pops up for me your omeprazole, so it's also called Prilosec. It's 20 milligrams every day, and this is for your heartburn. So you want that medication. So I'm going to pop this out into the medicine cup. I have this and give that to my patient to take. Okay. So I have, my patient has swallowed that medication and with no problems. Okay, so next I'm gonna have my Tylenol here. Okay, so I have your acetaminophen or your Tylenol for pain. It's 100 milligrams, so I'm gonna open this up and give that to my patient also. Okay, so I have my oral meds taken now. My nasal saline spray. I have this, let's scan this. I have saline spray for your, for a dry nose on your left side is bothering you more. Okay, I have this here. So I'm gonna pop this lid off here and let's see, I might have an alcohol swab. So I would wanna clean the tip of that. Again, this is only for this patient. No other patient's gonna take that. And we're gonna have her insert this into her left nair, spray, and ask that patient to breathe in. You may wanna have a tissue for your patient. She can lean her head back and swallow just to make sure that medication goes down her throat here. So let's clean that back off again for her. We've done our nasal spray. So you see I have a system where I'm moving one side to the other as I finish my medications. Next we have our saline eye drop here. Let me scan this. We have a saline eye drop for a dry left eye. Is that correct? Okay, perfect. Take my lid off here, clean the top. I'm gonna tell my patient, I'm going to tilt your head back a little for me, and we're gonna feel this bony prominence under your eye, and we're gonna pull down just very gently with our 2 fingers here. Tilt back, and we want to drop that medication into the conjunctival sac. Now, we don't want that patient, we want to instruct them not to squint too hard or it's gonna push that medication out. We don't want to touch or rub. We just want to have them gently close their eyes. If they need to push in this inner canthus here, that could be helpful. I like to tell my patients to close their eyes gently and roll their eyes back and forth. That can help. So move that off to the side. Next, we have our ear drops here. I'm gonna, again, take my lid off and clean that. I want to inspect my patient's eyes and ears to make sure they don't have any drainage and make sure those are good and clean. When I do my eardrop here, we're going to make sure the ear is clean. We're going to have them tilt their head to that side. We're putting this in her left ear. Pull that pinna up and back to open that ear canal up, and we're, without inserting the applicator into the ear, we're just going to hold on top, one little squeeze down, and then we're going to have them push it on this tragus. This tragus is the little part of your ear here. We're going to push on that tragus and let that flow into their ear canal. So again, this was your ofloxacin for your ear infection. Next, we have your hydrocortisone cream. Let's scan this. This is for a rash that's on your left arm. And then you're gonna also have a lidocaine patch for your left elbow. So I'm gonna make sure that I, with soap and water, clean this whole arm and let that dry before I apply these medications. So I've cleaned my arm. I have my hydrocortisone. I better put my gloves on because this topical medication ointment works by absorbing through the skin. So I don't want it to absorb into my skin, right? I want it to only absorb on my patient's skin. So my area is dry. I'm just gonna squeeze off a little bit of medication here, and I'm gonna apply it to the affected area. I'm gonna instruct my patient not to lay on that side, try to keep the sheet from rubbing that medication off. We want that medication to absorb to that area there. Okay, I'm done with that one, but I also have now my lidocaine patch here. Let me scan it. So your lidocaine patch for pain on your left elbow. All right, I'm gonna open this lidocaine patch up here. Again, I have gloves on because I'm doing a transdermal, trash. I am going to go ahead and initial 80 and date 130. No, when I gave this medication. So I want to peel the back off here. Apply this medication to the affected area. Make sure it's smoothed down. And again, I've already signed and dated that. You want to make sure we don't put any transdermal patches over a rashy area, an area that's scarred, that has burns, or open wounds in that area. So be very careful with that. So I've completed my medication administration. So I have done my right patient. I did 2 identifiers. I did my right patient. I did the right medications. I checked those. I did the right doses. We checked those. I did the right routes. We had multiple routes. I did the right time. I'm not sure I said it out loud, but I was doing the 9 o'clock meds. And then I'm doing the right documentation. As I'm scanning, it's documenting for me, but I do want to go through and make sure that everything that was ordered has been scanned. So I have completed my medication administration for my patient, Jenny Roberts. So I'm going to thank her for working with me. Here's your call light. Call if you need anything. And then I'm going to do hand hygiene and leave the room. A couple of medications that I did not have lying around that I want to mention would be a suppository. We need to make sure if we're doing a suppository, we have that patient lie on their left side with their right knee pulled to their chest. And we would, obviously with gloved hands, spread the buttocks and take that suppository. They're really lubricated, but you're going to see in literature it says to add more lubrication. You usually don't need to, but we want to make sure that area is nice and clean. So clean the rectum area, and then we're going to insert that suppository 3 to 4 inches. So that's going to take some insertion of your finger up to about here. The other one I did not do was an inhaler. I don't have one lying around. My scanner here, it's a thermometer, is shaped a little bit like an inhaler might be, not totally, but to instruct on an inhaler, we would tell the patient to, we'll shake that med first. We're going to tell our patient to put their mouth around the mouthpiece, and they're going to depress the canister, and that is what disperses the particles. So we're going to press in, hold for 5 to 10 seconds, and then exhale. If they're doing multiple puffs, we want to wait 1 to 5 minutes between those puffs. No matter how many puffs they have when they're finished, it's best practice to have them rinse their mouth out. It can cause a bad taste or cause a film sort of in their mouth. So those are all of your topical, oral and topical medications. We want to come back and check on our patient after oral topicals in an hour. We expect those medications to all take effect between 45 minutes and an hour. An hour is good practice to check back. Also, you'll find when you're charting, especially for pain medications, you have to reassess in an hour. So if you assess early, it's still going to make you reassess in that hour's time, okay? If we're doing IV medications, we expect that to take effect in more like 15 to 30 minutes. So we would check with that patient much faster, but just be sure we're checking back with our patient in an hour. And that is a very quick version of oral topical medications. I hope this helps.